Hey everyone, this is the intro to anatomy made easy, and in today's video, we're going to be discussing three topics. The first is the anatomical position, then terminologies, and then movements. So without much further ado, let's get started. So this is the classic anatomical position. Notice how the model is standing erect, looking forward. The arms are by the sides, and the palms and the toes are directed forwards. So why is this anatomical position so important? Well, the anatomical position is a standardized reference posture used in medicine. The key word being standardized, as in the same for everyone. And in clinical scenarios, doctors need to be able to describe the location of injuries, abnormalities, or surgical landmarks in a consistent manner. So later when we talk about anatomical terminologies and movements, keep in mind that the body is or was, in the case of movements, in the anatomical position, this precise position. And so next we have the anatomical terminologies. So anatomical terminologies is used to dictate directions. In other words, it's how doctors use fancy words to point out directions. And I'm sure all of you are very familiar with directions. So there's four important categories, and we'll go through them one by one. The first is anterior and posterior. If something is in front of you, you say it's anterior. For instance, the heart is anterior to the vertebral column. That's why we say it's in front of it. Next is the posterior. So if something is behind you, you say it's posterior. For instance, the heart is behind the sternum. Therefore, the heart is posterior to the sternum. And another word for anterior and posterior would be the ventral and the dorsal. And secondly, we have superior and inferior. If something is on top of you, you say it's superior. For instance, the neck is on top of the heart, so you say the neck is superior to the heart. And another word for superior is cranial. And if something is below you, you say it's inferior. For instance, the diaphragm is below the heart. Therefore, the diaphragm is inferior to the heart. And another name for inferior is caudal. And then we have medial and lateral. So when we talk about medial and lateral, we have to keep in mind one important little thing known as the midline, and it's this yellow line right here. So if something is moving towards the midline is known as medial, and if it's moving away from the midline is lateral. So example, the eyes are closer to the midline than the ear, okay? Therefore, the eyes are medial to the ear. And lateral is the opposite of medial. It's a position that is away from the midline. For instance, the arms are lateral to the trunk of the body because it's beside the body. And finally, we have the proximal and distal. And when we talk about proximal and distal, we use the trunk as a reference. So if something is closer to the trunk of the body, we say it's proximal, and if it's away from the trunk of the body, we say it's distal. And in this scenario, let's use the elbow and the wrist joint as an explanation. So here's a zoomed in version of it. So fun fact, the elbow joint and the wrist joint is also known as the radial ulnar joint because this is the radius and this will be the ulnar. And the only difference between these two joints are the location, proximal and distal. So the elbow joint is actually closer to the main trunk of the body. That's why it's known as the proximal radial ulnar joint. Whereas the wrist joint is actually further away from the trunk of the body, and that's why it's known as the radial ulnar joint. So that covers the anatomical terminologies. So we move on to the last part of the video, which is anatomical movements. So anatomical movements, in this video, we're going to be discussing two important categories. The first is the flexion and extension, and the second one would be the abduction and adduction. Now, there are a lot more movements out there, but for the sake of this video, we're only going to be discussing these two because they're one of the most common ones you're going to use in clinical practice. So, okay, let's start with abduction and adduction. So the thing with abduction, you can imagine it as an alien abducting you. And you know how you have the UFO and it's abducting your arm. So that's why in abduction, you lift your arm away from your body. The same thing happens with your lower limb. During abduction, you lift your legs away from your body like this, sideways of course. And the same applies with adduction, but opposite. So if you're talking about a deduction, you're moving the limbs towards the midline of your body. Same goes to the lower limb. If it's adduction, you move the limbs towards the midline of your body. And finally, we have the flexion and extension. Now notice how I separate these joints into two categories. You have the shoulder, elbow, and hip joint at the top, and a knee joint at the bottom. So the shoulder, elbow, and hip joint, they all share the similar flexion extension direction. So if it's flexion for the shoulder, elbow, and hip joint, it's all like this. And if it's extension, it's toward this direction. Whereas for the knee, the flexion is actually at the back, whereas the extension is towards the front. And why is that? Well, it's basically because during embryological development, you have the lower limb, they rotate and causing the direction of the flexion and extension to be opposite of the upper limb. So that covers most of what we need to know about the anatomical movements, terminologies, and position. And if you enjoyed this video, leave a like and subscribe for more. Thank you very much.